It's a skill that you're learning. You don't have to be this high-powered salesperson, and I think sometimes people think that, right? Like you got to bring in this like some over-the-top salesperson that sells yachts for a living to then be able to come in and sell dentistry. So
The answer to your question is anybody who's willing to learn. It's
yeah,
as
okay,
simple as
okay,
that. Anybody
yeah,
who says, you know what, I'm hurting. My case acceptance isn't what it should be. And I want my team to get better at this. And my team wants it too.
yeah,
So anybody who's coachable, who's willing to just be open minded and learn some new ways of doing things and trying
that's
new
great.
ways of doing things.
That's great. I love that. And that's exciting because you can take and learn it. It's a skill that you're learning. You don't have to be this high powered salesperson. And I think sometimes people think that, right? Like you got to bring in this like some over the top salesperson that sells yachts for a living to then be able to come in and sell dentistry. So I'm glad to hear that that's not the case because I don't think that fits well. And I think that's some of the negative imagery that people have around this particular topic. Now, so if you come in, so if I have 10 practices, 20 practices, and I have a team um, we're not selling dentistry the way that we want, and I bring somebody like you in to help learn these soft skills and then create a system or scripting or checklist for them to be able to work through, what kind of results do they see from that? What kind of percentage wise are you seeing from that?
Typically, double their case acceptance.
Wow. And what kind of
Yeah.
practices are that? Is that all kinds of practices, or there's specific kinds? What are you when you're saying double? What kind of practices are you referring to?
Practices who typically are at that 30 to 40% range. But I've worked with specialty, I've worked with oral surgeons, periodontists, and general practices.
Got it. Okay. Wow. So
I
yeah,
think
that's
that, yeah, the
huge.
general practices are going to see the biggest jump. Your specialties, a lot of your specialty practices are already getting their patients referred to them
Yeah.
already.
Yeah.
So they sort of already come pre-qualified. Like, well, I knew I needed to get my wisdom teeth out. I just
Yeah.
had to
Yeah.
go to an oral surgeon to get it done. Whereas it's a little harder with general practices. So it just means that the work that we do together, which is fun, by the way, and easy. It's not difficult. It's not hard.
Hmm.
It's not pushy. It's
Yeah.
not salesy. If anything, it's the complete opposite. So for people who are fearful of that, it's the complete opposite. That's the reason that I created this program, is for us to be able to help our patients get the treatment that they need